The number of people choosing not to have kids has doubled over the past 20 years.
That's according to a new study from Michigan State University, and TV5's Zane Omer dives into some of the numbers. Zane?
Researchers say the choice to not have kids could be more common in the future. A new study from Michigan State University shows more people are choosing not to have kids.
We kind of have in society expect people to want to have children, but I think that's changing.
MSU psychology professor and co-author of the study, Jennifer Watling-Neal, says the research focuses on figuring out the different types of parents living across the United States.
In most cases, when people have done research on different types of non-parents, they really haven't done it on different types of non-parents. They've sort of lumped all the people who don't have kids into a single group of non-parents.
Neal says they looked at the data collected from 80,000 adults in the U.S. under the age of 45 from 2002 to 2023. The research finding multiple types of non-parents.
We've got people who are planning to have children in the future. We kind of refer to those folks as not yet parents. They're probably going to become parents at some point in their life. We've got childless people who wanted to have children but couldn't have them either due to biological or social circumstances. And we have child-free people. So these are people who don't have children and they don't ever want to have children.
Neal says childless parents were the least common, staying steady at 3 to 4% of the population. Most common type of non-parent are the not yet parents, but the group in the latter is growing.
The percentage of non-parents who don't want to have children rose from 14% in 2002 to 29% in 2023. And that suggests that the prevalence of child-free people in the U.S. has been growing over the last 20 years.
In that same period, Neal says the percent of non-parents who plan to have children fell from 79% to 59%, a trend she doesn't see ending soon.
It might be important when we're thinking about medical services to ensure that they have access to reliable birth control and maybe even sterilization if that's what they desire. They may have very different financial needs given that they don't have children. So they maybe need to have different financial advice than somebody who does have children and maybe wants to put aside money for heirs, right? They may need more planning for long-term care.
This study did not show specifically why people choose not to have kids, but Neal says Pew Research Center surveys have shown that financial concerns, medical reasons, and restrictions on career growth or freedom are some of the reasons people opt out of becoming parents.